Hello and welcome to another episode of The Health Quest by Betty Okere. Today we are going to talk about kidney disease. And in studio we have a guest to help us delve deeper into that discussion in a bid to help make you healthy or help you prevent diseases. Thank you and welcome. Dr. Welcome to our episode of The Health Quest by Betty Okere. Please tell us what your name is and what you do.
Thank you. My name is Mehreen Adam. I'm a nephrologist, currently working in a private institution, a hospital, and I have an interest in spreading kidney awareness as part of, I think, our responsibility to our public. And in keeping with our World Kidney Day celebrations, which we've been doing for the past week, countrywide, we're aiming to increase awareness of our public on kidney disease. And that's why I'm happy to be here, for us to maybe demystify some myths, maybe give some of our audience some tips, and hopefully benefit our viewers.
Thank you very much. And we actually appreciate you taking the time off to help us discuss some of these issues. When you're introducing yourself, you actually mentioned that you're a nephrologist. Is it safe to assume that that is somebody who specializes in?
A nephrologist is a kidney specialist. So it's you qualify with your basic medical degree, then you further specialize in internal medicine, becoming a physician, and thereafter you do your fellowship in nephrology. So it's a long process, but eventually becoming a kidney specialist. You manage kidney diseases, not necessarily only hospital-based. Most of the patients that you will manage are outpatients, so patients on dialysis and patients that you see in the chronic kidney disease clinics.
I would like you to help us understand. So what are kidneys? Where are they in our bodies? What sort of organs are they? And what specific functions do they actually perform?
Okay, so it's very interesting. On our World Kidney Day awareness, we were actually asking our audiences that where do you think your kidneys are? And a lot of our people don't even know exactly in their body where they are. But they're a retroperitoneal structure. So you have two kidneys. Generally, most people have two kidneys, although some people are born with solitary or one kidney, and they do and can live a normal life. But generally, most of the public has two kidneys, and they're, like I said, located retroperitoneally, so just at the back, in the lumbar region. And they have a very specific function. We all know that urine is produced by the kidneys, and in doing so, they're essentially flushing your body of toxins. They're maintaining your salt levels within your body, your electrolytes within a normal and specified range, and that's their critical function. But there's other functions of the kidney that people tend to overlook, and those are that it also secretes hormones, hormones that are essential for blood pressure control, for example, for building blood cells, and for maintaining bone health. So when your kidneys are affected, they don't get affected in isolation. They tend to affect even your bones. It can affect your blood counts, and so that's why when we're raising awareness, we're trying to inform the public that it's not only your urine that might reflect a problem with your kidneys.
Any suggestions of any bone dysfunction that then we would have as a result of a kidney problem?
Yeah, so the hormones that your kidney secretes, basically they're to activate your vitamin D, which is required for calcium absorption in your body. And so when you have kidney disease, you tend to have derangements in your calcium, in your vitamin D, in your parathyroid hormone levels. And as a result, you can get weak and brittle bones. You can have increased risk of fractures. So sometimes the patient might just present with, fractures with minimal trauma. Suddenly they've slipped and they've fractured a bone. And when you evaluate them, it's actually as a result of that long-standing problem that no one had detected. So it's important to remember these other functions of the kidneys as well.
Okay, thank you very much. And that's actually very insightful. Do we have any risk factors that would predispose a person or would make them be susceptible to getting kidney disease? And are there different forms of kidney diseases that are very common in our country especially?
Yeah, definitely. So the major contributors to chronic kidney disease in the country are diabetes and hypertension, uncontrolled. And it's just the nature of the disease that if the sugar levels or blood pressure levels are not controlled, they're ultimately going to affect your kidney. And depending on how poor that control is, the disease can progress rapidly. And that's why we also advocate for early detection of diabetes and hypertension before it leads to kidney disease. So that's the major cause of kidney disease in our country. But there are also other forms of kidney disease that we're seeing more. You have infections that can lead to kidney disease, and this isn't only just recurrent urinary tract infections, other diseases like HIV, which is on the rise, and we have quite a prevalence here. They also affect your kidneys. You have conditions, genetic conditions like polycystic kidney disease that tends to run in families, and as a result of that, most of the members of the family, if you took a history, were affected by kidney disease, but no one knew or no one screened or detected these people. So this is the common causes that we're looking at. But we don't have data specifically on our kidney disease prevalence, which suggests about 10% of the population worldwide has kidney disease. You're looking at 4 million upward Kenyans that could be affected by it and possibly don't even know.
Okay, that's quite shocking, and that's actually a big number, because sometimes maybe people even do not know that there is the genetic predisposition to chronic kidney disease. But you mentioned something that I would take you back to. The fact that recurrent urinary tract infections can actually be another cause for chronic kidney disease. Would you like to expound more on that?
Yeah, so when someone presents with recurrent urinary tract infections, if they're not in, for example, a postmenopausal female, you want to really review that anatomy, that is there some obstruction occurring that's predisposing them to getting these urinary tract infections, especially males who tend to have a longer urethra, and therefore colonization risk is usually lower. So when you have a male, especially with recurrent urinary tract infections, you want to evaluate them for any obstruction in the urinary tract. Children, for example, with what you call posterior urethral valves, patients with kidney stones, recurrent stones, any obstruction in your urinary tract, basically from your outward from your kidneys, your bladder, your ureter, the urethra, all these can lead to kidney disease. In your elderly males, conditions like benign prostate hypertrophy or BPH, prostate malignancy, prostate enlargement, all these tend to exert pressure on the kidneys as a result of the prostate enlargement. And therefore, a lot of our patients, we also screen their PSA levels depending on their age and risk factor. So that's standard nowadays screening for all our male patients above a certain age. So these are some of the things that we look out for when we're evaluating these recurrent urinary tract infections.
And at what point do I say, I think now this is recurrent UTI?
Yeah, so generally 3 episodes per year, more than 2 to 3 episodes per year qualifies as recurrent UTI, and it needs to be evaluated. A lot of our patients just tend to go to dispensaries and pharmacies and self-medicate. but that also brings a lot of problems in terms of now our management. We get a lot of resistant bacteria because they're overusing antibiotics over the counter. So we're really also advocating, part of our antibiotic stewardship is, guideline-based antibiotic use.
Thank you very much, Dr. And now for someone who you've already been diagnosed with chronic kidney disease. What treatment pathways do we follow? What would we advise them to do?
Okay.
Yes.
Yeah, so it's a journey that we take with our patients. So these patients initially were assumed to have a death sentence once they thought they have kidney disease. They assume now dialysis is knocking on our doors. But now we have a lot of medications and modalities in which we can delay the progression to dialysis. So dialysis is an eventuality that we have to bear with, but to delay this progression from diagnosis to end-stage kidney disease, we have lots of medications now in the market that can slow, for example, the loss of protein in urine. We have newer drugs, SGLT2s, GLP-1s, that are being put in as part of our package to slow down progression of this kidney disease. So that's number one. Number two, we advocate patients to follow a specific lifestyle and dietary modifications, limit alcohol, manage their weight within a normal BMI, reduce their salt intake. I think that is one of the biggest things that we advocate, is that you should reduce your salt intake. And a lot of patients don't realize just how much salt they're consuming from packaged processed foods, canned foods. All these are very high content sodium. These condiments, sauces, soya sauce, all these have a lot of sodium. So we advocate for them to reduce their salt intake and hydrate adequately. And, obviously exercise regularly, get yourself regularly checked by your physician. And once you're diagnosed, then you need to be on regular follow-up with your nephrologist, because based on the level of chronic kidney disease that you're at, we'll then make recommendations for the frequency that we're going to do your kidney function test, we're going to do your bone test. So it becomes a journey that we walk with our patients from the time of diagnosis.
And thank you very much. It's actually interesting that you mention reduction of salt and give examples of other forms in which the patient or somebody could actually be consuming excess salt without knowing. Because sometimes we tend to think that when we say reduce your salt, we basically mean when you go home, don't add salt to your food. But there are other things, especially the processed and canned foods that people consume in large amounts, that could actually be predisposing them to the problem. And I think that is a point that people really have to take seriously. Hello, my name is Betty Okere, a clinical dietitian and diabetes educator. Brookside Plus probiotic yogurt provides you the goodness of good bacteria for a healthy gut and a good immune system. Probiotics are live microorganisms that can be added into our food or into our gut system to help us be able to maintain a healthy balance, thereby promoting good health and supporting our immune system. Brookside probiotic yogurt, you can use it in any form. Add it to your smoothies, drink it off the glass, and you will be able to enhance that healthy digestive system. Do we have resources around, especially in our country, or do we have facilities where people can just go and be educated about the kidney disease, what it is, or does it only happen on World Kidney Day?
Yeah, so that's something that we've really been moving for, patient awareness, public awareness. So we run public health talks as part of the Kenya Renal Association throughout the year, but our obviously main focus is during the World Kidney Week. Aside from that, there are patient support groups, which obviously are voluntary based, but through these support groups, patients are able to share their stories, share their journey, and we have nephrologists and physicians who volunteer to educate these patients, who then educate their relatives and friends, and it's through this type of advocacy that we're really trying to focus to increase awareness on kidney disease. We are trying to, streamline it such that the correct message is going out as well, because there are a lot of myths that surround kidney disease. And it's important as well that as much as you're trying to give out correct information, that along the way, things are not misconstrued and an incorrect message is going out, because your kidneys are your life. And so it's very important that qualified persons are the ones that are leading these discussions.
Okay. And do we have sufficient number of professionals for this?
It's unfortunate. We as of I think 2022, we only had about 50 nephrologists in the country.
In the entire country?
In the entire country. So by now we possibly might be around 60. But it's unfortunate that we have such a dire need because of our growing kidney disease population, that we have so few nephrologists in the country. But since the demand is there and the interest is there, I'm sure we're going to, even up that gap, even no matter how long it takes. It's something that the Kenya Renal Association also is working hand with other international societies, for example, the International Society of Nephrology, to help in training local physicians as nephrologists.
That would be great. And actually that would help. When you mentioned the number 60, I was just thinking to myself, sounds like half of that population is in Nairobi and the other half is shared by across the major cities. So what happens to people in the periphery?
Yes, exactly. That's where our problem comes, because then our patients are in the hands of healthcare personnel who might not be really qualified enough to manage kidney disease, but unfortunately they're the only ones on the ground or available. And I know that our council has been having discussions on all these calibers and which ones are qualified to do what. So you might have a patient, with kidney disease who requires dialysis, and someone who's inserting the catheter may not be qualified for that, but they're the only person around, and that's the reality that we have to deal with currently due to this shortage. In an ideal situation, if every county had a working, functional, at least dialysis unit or kidney disease clinic, we would allocate at least a nephrologist per county. But that's in an ideal setup, and we're far from
wishful thinking.
Yes.
But maybe we're heading there.
Yeah.
The future is not so bleak, hopefully.
Yes.
And that is one of the challenges. So the specialists numbers do not really match the demand for this disease condition. But what are other challenges that we're facing? Can people afford treatment for?
Yeah, that's the problem. A dialysis session, one session costs about 9,500 shillings per session. And if they're not covered by insurance, there's a very low number of people that would be able to afford that type of, considering that you have at minimum 2 dialysis sessions a week. So that's almost 20,000 shillings a week. So without insurance, our dialysis units would ideally collapse. A lot of our patients rely, therefore, on public insurance, the SHA currently. There's a lot of out-of-pocket expenses that also come aside from the dialysis. These patients tend to have diabetes, hypertension, so they're on these medications lifelong. And those medications are quite costly if you look at it on a monthly basis. And so these are the type of challenges, mainly financial, that our patients face. And then the society as well. There's pressure from, they have a very specific diet, for example. So if they're at community events, they're not going to be eating the same food that everyone else is. And so they tend to get a bit isolated. Adherence then becomes a challenge for them. They have very strict fluid restrictions with their dietary restrictions. Their adherence then changes. We have patients who just simply give up. So it is a lifestyle change, and these are some of the challenges that they face. But I think monetary being the top.
Is it then you mentioned something about their diet and all the fluid restrictions and what they have to do just to be able to manage their lifestyle. And as we said, the specialists are not there. Is it easy? How easy or how difficult is it for them to actually get the correct specialist to manage the diets?
Yeah, it's very difficult because ideally you would require a renal nutritionist to follow up the patients from diagnosis, and unfortunately we don't have enough of those renal nutritionists. So even the advice that they get on their diet sometimes can just be something that they've picked off the internet. And like I told you, the numbers we have, one nephrologist might be seeing hundreds of patients a day, may not have enough time to dwell on each person's diet, and that has to be, it's very specific to each person, based on their phosphate levels, their potassium levels, There's a lot of factors that contribute to, what specific diet they're going to follow. And unfortunately, we don't have that many qualified renal nutritionists to give that information out. But again, like we said, these are things that we're working on. We are better than we were 10 years ago, and
Definitely.
we hope we will be even better.
Definitely, we hope it can get better and we can give better services to our population that actually requires management and treatment. And any myths and misconceptions that are common around kidney disease?
Yeah, so there's a lot of things that you hear. The first types that, like we were speaking earlier, is about reversal of kidney disease. A lot of people claim that they have cured somebody of kidney disease, that they have some herbal medication that can, reverse kidney disease. But the truth is, a lot of these herbal medications are detrimental to your kidneys. They're toxic to your kidneys. Over-the-counter painkillers, NSAIDs, these are some of the medications that nobody should be taking without consulting a doctor first. And these are the type of myths that we're trying to, demyth. I think other things are, like I said, initially it was thought to be a death sentence, and that now you have it, it's the end of your life. But we've made, we've moved forward leaps and bounds, and patients can live a normal life, relatively normal life, with certain restrictions. And then I think a lot of the time, a lot of patients think the more water they drink, they roam
the better
around
it is for the kidney.
With like 5-liter bottles, 3-liter bottles. But we generally say that, initially at least, about 2 liters. So, like we always say, your brain is smart enough. You have a thirst center in your brain. And as long as your brain is functioning, you haven't had an event in your brain.
You can be able to tell you when to drink the water.
To drink,
But that's a bit controversial. There are people who actually can stay 2-3 days without drinking water. Don't they get thirsty?
So, we advocate generally, but remember, people who are living in hot climates, people who are sweating a lot, running a lot, these are insensible losses, meaning that your requirement for water would be even higher. So that's why to just say that everyone should take 3 liters, this type of generic values can lead to problems. For example, if you tell a person who has heart failure as well as kidney failure, if they go on drinking 3 liters of water, they would probably collapse, and Yeah, so it has to be individualized, and roughly about 2 liters is generally what is required. And it doesn't have to be absolutely plain water, some flavored water, as long as you're hydrating yourself.
Do soups count?
adequately. Sorry?
Do soups
Yeah,
count?
soups,
As long as we
actually,
don't have excess salt
yes,
in them.
exactly, without too much salt.
Juices?
Yeah, fruit juices, all your fluid really should be within 2 to 3 liters generally. I think in the salt part, it's very hard to explain to patients that just how much salt is required. And we tend to tell them, cook at home, so you know exactly what's going into your food. And those salt sachets that you get with a packet of chips, for example, that's about 5 grams, and that should be your limit for the entire day. You should never exceed that. So, these are small things that we want to convey to them.
Quite interesting and quite informative. We do a lot of kidney transplants, and I know back in the days, a lot of patients would then have to travel outside the country, medical tourism for kidney transplants. Are we doing them locally? Success rates? How are people embracing it? Is it affordable?
Yeah, so it's remarkable from where we've come. I think currently we have our 2 major public hospitals where we do a large number of kidney transplants at the Kenyatta National Hospital and Moi Teaching Eldoret. We also have in private hospitals transplant programs that are quite robust, and the difference mainly being in terms of cost. Public hospitals, around $5,000 is what we're looking at, and we're currently, that's the minimum coverage from insurance. In private hospitals, about 2 million approximately. And, the package differs depending on the length of stay in the hospital and various other factors. But people often forget that aside from the transplant, these patients are going to be on lifelong immunosuppressive medication to prevent rejection of that transplanted kidney, and those tend to be quite costly as well. So when budgeting for the transplant, it's not just the procedure that they need to budget for. They need these immunosuppressives lifelong, and it's some of the discussions that we've constantly been having with our insurance, that if it can be covered, at least in some form, for our transplant patients. So that's something that we're really that the Ministry of Health will look into.
And be able to pick that up.
Yeah.
Okay. And as a layperson, what do I look for? How do I tell that now I could be having a possible kidney disease?
Yeah, so the danger signs. So usually we tend to say that kidney disease is a silent killer, simply based on the fact that it usually presents quite late if you don't look for early warning signals. But generally, changes in your urine, so changes in your frequency, changes in the volume, dark, bloody, foamy urine is not normal. Swelling in your feet, in your ankles, facial puffiness, that's not normal. Tiredness, fatigue, nausea, vomiting, these could be signs of buildup of toxins in your body, and that could reflect that you have a problem with your kidney. So these are some of the subtle signs that you could pick up. But just being quite vigilant on your urine, especially, and your well-being is important, because especially if you know that your parents or your grandparents had kidney disease, or they were diabetic, or you are diabetic or hypertensive, then you need to be looking out for these things more often.
That was such insightful and informative discussion, Dr. Thank you very much. And as a parting shot, what are 3 things on top of your mind that you would want our audience to know about kidney disease?
Okay, so like we always say, healthy kidneys, healthy you. So your kidneys are your life. Guard them safely. Avoid the use of over-the-counter medications, over-the-counter antibiotics. Those are one of the commonest causes of kidney disease, on top of diabetes, hypertension. So if you are diagnosed with either diabetes and hypertension, get yourself regularly checked by a physician or general practitioner. And lastly, adjust your lifestyle slightly now when you can. Exercise regularly, hydrate adequately, and follow a balanced diet, a low sodium diet. And generally, those type of small steps can keep your kidneys happy. And always consult your practitioner, general practitioner or physician before using any medications over the counter.
Wow. That is so insightful, and I'm sure our audience have actually benefited a lot from this discussion, from this talk, and looking into the future. Probably you've picked a point or two that would help yourself or somebody else to prevent kidney disease, and if they have it already, to be able to manage it even better. Thank you very much. That is all we had for our episode today on Health Quest by Betty Okere. We continue to receive your feedback and comments on our shows. You can reach us on all our social platforms. And until next time, it is bye-bye for now.